I came across this one patient who went through this very expensive surgery. I mean, she had this bilateral transplants. In simple English, she had transplants in both eyes where she had a donor cornea. The doctor did not tell her that you will still need hard contact lenses after this. So she's been living her life just like that. She couldn't see. Her mom is driving her around. She's not able to get a proper job because she can't see. She can't work on the computer. She's not able to go to work. So she's working from home, and not all jobs pay you well working from home. So this patient drove all the way from Mississippi to see me. She heard about me from somewhere, a friend who works in the medical center, and I got my training in the medical center. So I feel blessed to be able to come from a bunch of doctors who used to do medically necessary contact lenses. So she comes in and we try a couple of Scleral lenses, which is like a large kind of hard contact lens that covers that transplant. So the tricky part with that is like you have to have really good technology to make sure that that transplant is not touching that contact lens, because you can actually hurt their eyes. That transplant can get scarred up if that contact lens is touching the eye. So the most important part is having that right technology. The second part is having those right skills. So contact lens has always been my passion. I took that challenge in my third year and fourth year. I was awarded the best contact lens award because I would just sit down and crunch all the numbers and find the best contact lens for this patient without even seeing them. I would have their chart and I would just calculate a contact lens for them. But the best part for this patient was that when she came for her first follow-up to pick up her contact lens, her mom brought her because of course she can't drive. And then when she puts the contact lenses on, this patient can now see 20/20. And she's like, Mom, I don't need you to drive me around anymore. I can see. We don't think about it that way. If you are able to drive every day, you don't think about the fact how important that is, that independence, that's a big deal. So contact lenses can change your life sometimes. It lets you see, and we underestimate that. I wish that doctor who did the bilateral transplant told her that you need to go get, those hard contact lenses very soon. But she was living her life under the impression that I'm going to see after these transplants. I got this expensive surgery done. I should be able to see. That was incorrect. So sometimes there is a lot of miscommunication that happens between doctors and patients, and I think you can blame doctors very easily. The patients don't know. Doctors should know better.